Shall I send it, of course, to the same mail I had it? No, I cannot. It's too heavy. I mean, I need WeTransfer. I need an address. So I send it to Pardeep2128, okay?
Amit, do you have the presentation with you?
No, he has not.
No, sir, I don't have.
Okay, fine. I think Pradeep is also having a problem. Let me call him and ask him to share.
I now send it to the email address that...
Hello, sir.
Hello.
Marco.
Yes.
Yeah, I am just sending my mail ID in the chat box itself. You just forward the mail to me once.
Yeah,
okay.
that will be good. Marco, you please send to Amit, and then Amit share that from the...
Ahmed, send it to where now?
The chat box itself in this WebEx. Or I am just sending a mail to you. Just a minute.
In the chat box, okay. Okay, Ahmed Kar. Okay, yeah. So, and now I transfer it via WeTransfer, okay? I will send it to WeTransfer.
Well, meanwhile, I just take this opportunity to introduce Professor Marco Leonti, who is a professor from Department of Biomedical Science, University of Cagliari, Italy. Marco Leonti has graduated in biology at the University of Basel in 1996. From 1999 to 2000, he conducted ethnomedicine and anthropological field survey in Mexico and got his PhD degree in pharmacognosy from the ETH in 2003. With a study focusing on ethnopharmacological, phytochemical and biological evaluation of indigenous medicinal plants there. After postdoctoral position at the London School of Pharmacy and the University of Cagliari, he was made associate professor at the Department of Biomedical Science of the University of Cagliari, where he teaches pharmacognosy. He is currently engaged in the isolation and structure elucidation of cannabinoid, antibacterial, and cytotoxic secondary metabolites from plants and traditional medicines. His research follows evolutionary approaches and focuses mainly on the cultural history of human plant use and rationale of human plant selection for medicine and nutrition. So I now request Amit to kindly share the slides so that presentation
They have
can be
not yet
started.
arrived. Moment, I need to do verification code. Okay, now it comes via WeTransfer. It's 70.7 megabyte. So it takes a second until it is with Amit Kar. So yes, I mean, I could theoretically already start a little bit. It's about let me see the title we wrote. It's about traditional knowledge.
Marco, is there anything like, say, in the sharing option, you can make the things again rejoining, you can share something like that? Try.
And now I have sent it. Now it's arrived to Amit.
Okay, no problem.
It's arrived now. Sure. Okay. Yeah. So, yes. Has it arrived, Amit? Can you download it?
So still not, I didn't receive. Yes, I have received that one. I'm just downloading the presentation.
Okay, great.
Banji, done.
Amit, your share button is active.
Yes, sir. My share button is active, sir.
Okay, fine.
Okay.
Sir, it is visible. The presentation is
bit-
visible, sir.
Yeah, it's a little bit small, but it's visible. Yeah, it's okay. Now it's okay.
Yes.
Just close the chat. Yeah. Shall I start? Shall I start?
Please, sir, please.
Okay, thanks for the nice introduction and sorry for the delay. So, the title of this talk is Ethnoparmacology and Documentation of Traditional Knowledge. So the first question will be, what is traditional knowledge? There is one definition that sounds more or less convincing. It says that traditional knowledge is knowledge that has been passed on, including 3 generations, with 2 transmission steps. Like the grandfather tells it to his son, he becomes father, and then he passes on the same information to his child. So 3 different generations are included, and if I only pass on some information to my son, this is not yet traditional knowledge. And of course, for example, like anti-COVID medicine that has been used, traditional medicines that have been used also against or for treating COVID, in that sense is not traditional knowledge. It is traditional, it is based on, have of course used medicinal plants and herbal drugs. They knew already. They knew they were good for respiratory tract infections and so on, but no one really had an idea whether it can be an antiviral or not, a specific antiviral, because COVID is really, the viruses need specific treatments. There are not like antibacterial drugs. There are broad spectrum antibacterial drugs. Mostly antiviral drugs have a narrow spectrum. So this is not really traditional knowledge, even though it is based on traditional knowledge. So 2 steps of transmission, including 3 generations. So please, next slide. This presentation has actually been done in relation to a review article we have wrote for the Journal of Ethnoparmacology, pointing out a little bit the problematics that we see when researchers submit papers documenting traditional knowledge and, of course, traditional medicines, and send this to the Journal of Ethnopharmacology. Ethnopharmacology is a very interdisciplinary field of research: anthropology, ethnography, pharmacology, medicine, history, epidemiology. Everything can be combined, and the research will be an exemplary or good research when we also dig deep and we accept the methods from the respective fields and do not invent new methods. For instance, statistics is real statistics and not some invented statistic by botanists, for instance. Botanists are very severe when it goes about plant identification and taxonomy. They would not allow that we take plant identification code or organization of taxonomy that is not botanist. We don't follow pan taxonomy of statisticians. Okay, it is quite clear. But still, one of the many problems is that the descriptive statistics used in these papers that comes was published in botany journals basically is not accepted in statistics. So this I mean with interdisciplinary. So we respect the standards of the different disciplines that are involved. So this means that those field studies, which contain primary data, this is the data we gather in the field. People who talk to you and say, look, I use this and this botanical drug, this animal part, when my child or I am sick from this and that disease, so we have this and that health problem. Maybe they show you even how they apply the drug, how they cure. So this is primary data. This is the important data, the observational data. This is primary data, and much of that primary data can be quantified. And the first question, for another question, the second question, let's say that, because the first was on traditional knowledge. Why doing such kind of research? Well, there are many reasons why one can engage in ethnopharmacological field studies. And of course, such data can be important for the public health sector, for drug discovery, for medical anthropology, which is also important for the public health sector. It can be important to pick out botanical drugs in order to do clinical trials or treatment outcome studies. So you really see what is happening in the field when people take a certain drug, certain botanical drug, and you accompany the whole procedure from preparation, people that get cured or not cured, people that are diagnosed ill and they receive those drugs, those treatments, and then you really go and speak with the people and say, have you become better? And then you need, of course, like in a clinical trial, two groups: those that were ill and have not received the respective treatments, and those that have received the respective treatments. But the reasons why, or the justification for doing ethnopharmacological field studies that are provided in those many submissions or publications justifications are like, because we did that research because no previous research has been conducted in that specific location or with those specific group of people. Or it is important because 80% of the people in developing countries use traditional medicines as their primary source of healthcare. Now, whether are 70% or 60 or only 50%, I don't think this plays a big matter. And it's important to a large part of the society, of the global society today. And then another reason is that there is a need to document traditional herbal knowledge, to save it from loss for future generations, and as a source for potential drug discovery. Now, also here we have to say that it can be true. This can be very justified reason, but so much has been written already about plants used as medicines. So that, especially in Europe, for instance, now even more than in India, or, there's hardly anything new from the field studies coming, because most of those herbal drugs are already documented. So there's not really endangered knowledge here. It is written in herbal books. You can buy them. You can buy them in stores. You can have the information on the internet and so on. So next slide, please. So when we're planning a research, it's important to know actually what, first of all, what and why we do want to know certain aspects of healthcare. And we need to, after checking literature like food economy, anthropology, ethnography, epidemiology, background from ethnoparmacology. I mean, you go to talk to the clinicians. If there is a health outpost, like a little hospital, you can go and talk to those people and ask, what is the most frequently mentioned problems the peoples actually have when they come to attend you, you know? So from all that information that you gather before you start doing field work, okay, then you develop your hypothesis and research question in order to fill the gaps of knowledge, to close them. Then you can solve real world problems like contemporary issues in public or private spheres. And then you can develop questions that go way beyond just simple descriptions of what people use and do and simple quantifications. For instance, like questions like, when do residents avoid governmental health clinics? And when do they resort to traditional healers and traditional medicine? So, okay, please, next slide. The current situation is this, that most of those papers that being published or they're being submitted to Journal of Ethnoparmacology or published elsewhere have a little bit lack of novelty, you know, and I think this little comic here exemplifies it very well. You know, if apples fall from the tree along the law of gravity in China, they will do so in India, they will do so in Africa and everywhere in the world. So what is really important when you write an article, it's not about data gathering at the moment. The next steps will be, how do we gather the data? Is what is actually the characteristic part of a traditional medicine in your project? What is different from the rest of the world? And you can of course also say what is very similar. But most of the times people write about, you know, leaves are the most frequently used drug. You know, this is so around the world, this is not really interesting. Or they say Asteraceae, Fabaceae, the most frequently used plant families. This is also now very well known. Or they say infusions and decoctions are the most popular mode of preparation. Also, this is, you know, is not adding anything new. Or then people say or write about who knows more knowledge, or either women or men. And apart that there is a huge bias in doing field work, whether the informant was a woman or whether the researcher in the field was a woman or was a man. You know, respondents react differently, tell more, tell less. Maybe women are not so open when they're interviewed by a man, and so on. So, and it's anyway, it's always either, you know, either women know more or women know less. So this is not, or men know less and men know more. This is not so interesting when it's not coupled to another question that is like, and why is this so? And what kind of knowledge do women know more? And what kind of knowledge do men know more? And then see if this information is important for public healthcare. So please, next slide. So what is important with what you would need to consider and think about is, why is the research area that you have chosen, the population that you think you would like to work with, of interest and relevant for the specific research question you have. And this information then, you like when you write a paper, should come in the introduction, possibly, you know, where you can also give information about the ethnographic background, the whole history of that people, the epidemiologic background, and of course, what kind of possibilities in healthcare do people have? What kind of options are there around? Are there pharmacies? Are there healthcare centers? Are they only dependent on traditional medicines? This makes a huge impact. This makes a huge difference on how people use the natural resources, the bioresources. Please, next slide. Yeah, next. So I was working, for instance, with the Popoluca Amerindians in Mexico. That was in the year 2000. And there's a huge biodiverse area with around 3,000 species. And there are little pharmacies, grocery stores. They sell also pharmaceutical drugs, of course, not just a limited amount. There are little healthcare centers, but people still resort to traditional medicines. And here, for instance, a woman is preparing a maceration of leaves that are considered to be cold. And these macerations, next slide, please. This maceration is filtered to get just the cold water with the maceration of the plant. Please, next slide. And this maceration is then poured over people that have fevers. Or they think fever is a hot disease. We need to cool the body down with the properties of those cold plants in a cold maceration. Okay, they don't even drink it, or just a little bit. But they don't think that there is the concept of pharmacology is completely different. They don't think that you need to orally absorb these macerations. Just a shower is good. Other forms of treatment, psychological problems or social problems, they are generally attended by curanderos that are also called brujos. They have, for instance, here a little altar, a little with Christian saints, but they don't really know. They're not really. They're also pagan. They just have this photos and pictures of the Christian saints, but they do not really know who they are and what they stand for. So there they attend patients who have social problems, and then they talk to them. They talk to them, see, what is your problem? Your man is drinking too much. There is domestic violence. You do not agree that your son is marrying this and that girl. Any kind of problems in the village are attended by such curanderos, and then they make a purification ceremony in front of this altar here, with lotions that are strong smelling, and some plants like basil leaves and pepper leaves they use for cleaning the body and sort of tranquilizing the patient. Okay, it's like an anxiolytic effect that you actually have, that when people can finally tell what their problem is to someone that's neutral to the family. Okay, next slide, please. This one is the ceremony, the cleansing ceremony with pipa, auritum leaves, and basil leaves in the field. Okay, in a cave, actually. This is in a cave near Catemaco. Next slide, please. They have also midwives. This woman here is actually a traditional healer. She knows a whole lot of plants. She learned that from her mother, and she uses those plants for any kind of healthcare problems. But she knows also about midwifery, and that's why she was included in a governmental program and trained to deliver anti-baby devices, anticonceptives, okay, like pills or injections with deposit injections that last for 1 month, just for birth control, because many women there, they have up to 10 children, and this is simply too much for them. They don't want so many children anymore because it leads to poverty. They don't have enough land for everyone to work on. So there are a lot of children and poverty, and they cannot afford to send them all to school. And above all, it's not very healthy for the women. And they have pretty highly inflamed bellies after 10 deliveries. So this is a way how to deliver like governmental healthcare to the population through indigenous persons, because they can speak their language. They can speak both Spanish and indigenous language, and that's how people are more confident in taking those medicines. Okay, next slide, please. This is like a grocery store selling also some pharmaceutical drugs. They are stored at room temperature that can get up to 40 degrees in summertime. Okay, next slide, please. So the methods, of course, are an important issue, because the methods, clearly described methods, allow anyone to repeat your study as far as possible. Crucial point is the selection of the participants and how the interviews have been conducted. You can select only specialists, or you can select a broad array of general population. You can do both if you have enough time. But of course, the data then is different. If you then mix everything together, that's not the right way, because a specialist has other kind of knowledge than the general population. So if you mix that and make after that general conclusions, we want to draw general conclusions from that data, it's not really general conclusion. You have to always consider that there's some specialist knowledge, which is most often very different from what the general population even knows, even though there is a huge overlap, of course. You would need to describe the methods for how you collected that information. What I always did, because when I gradually learned when I was in the field what is best to do. When I found a specialist that was open and willing to collaborate with me, I asked him or her if we can make a trip to the countryside, to the fields, or where places persons really knew, and where they go usually to collect the plants. Usually, this is the way when they go to their milpa, which is their maize fields, right? This is the roads they know best, of course, and that's where they know the plants are growing. So we made this little trip, and they would stop every 10 meters or every 15 meters, okay, hand me over some leaves, and this is this and that plant, this we use for this and that, and so on and so on. And there's so much information, I could not write it down in that piece of moment. And I could not take herbarium vouchers all together at the same time. So I didn't want to waste too much time from my informants, and I was just taking little bits of those twigs of those plants, leaves, flowers, if there were, and put it in the huge bag. Okay, try to remember, of course, but I put everything in a huge bag. And then we made a trip of about 3 hours, maybe. We came back to the house. The family was already waiting, the wife was there with children, everyone. And then I went to buy something to drink. offered to the whole family, and then I took out of my bag singularly every piece of plant again with my block, with my journal field book, and then I started writing down all the information. And I said again, oh, so this plant is yet again which, and then I said it, the whole family started discussing, oh yeah, this is this, yeah, we use it, I use it also, and the children knew it. And then I write this all down, what is this good, what is this used for, how it is called, and everything, okay? So you can work better than like writing down in the field when it rains or when it's too hot. It's not the best method to do. So it's also important to give the information that who conducted the interviews and in which language the interview was held and what kind of question were asked. I was just asking, I never asked like, do you know this plant, was it good for? I never asked this. I just waited that people showed me the plants they use. So I didn't want to make this question that actually elicit a response, because they could also give me wrong information. Even though I knew this is a very important plant for many, they were not pointing it out to me. I was not asking. Probably they knew it, but they didn't want for, or they overlooked it, or I don't know. But I know I was not asking. I was just taking notes about the plants they spontaneously mentioned to me. And this goes along with a little bit with the technique of participant observation. With participant observation, you're just there, you're trying to integrate into society without actually influencing the normal trajectories of the social behavior during the day. You just like integrate yourself. You're not too dominant. You're in the background, and just look what people do. And you want to see if people also do what they say or how they do what they say, because then you know better what they mean, what they are saying. If you also observe them in the field, when you see what they're doing, and you understand much better their the meaning of their words. And this is called triangulation. Yes, you have the written information, and then you observe also in the field, and then you see, okay. People do what they say. If people do what they say, this means this. Okay, next slide, please. And what is also now frequently, also due to the pressure of publishing a lot of papers, you know, people trying to slice up their work into little pieces. So they like to publish like just plants or medicinal plants used for diabetes, plants used for hypertension, and so on. But we all say, no, you just try to keep the focus on the whole materia medica, on the whole medical flora, including also the plants you use, because this information goes together. Because first of all, plants are used for a range of disorders. Most of the plants don't have only one therapeutic indications. Most of the botanical drugs do not have only one indication. And for instance, if like imagine you would only look at the plants and botanical drugs used to treat diabetes. Maybe you have 100 collaborators, informants, and roughly 50 of them report that it can be used for treating diabetes. So next slide, please. But what would happen if you would ask about a whole range of diseases and healthcare problems this plant is being used for? Maybe the picture is like this. The most frequently used, you get about 80 reports for as a diuretic. You get reports for using it against hypertension. And then you see that the most important indication is not diabetes. It's actually as a diuretic. And now, even more so, you see that diuresis and diabetes and hypertension, they're all connected. People that are diabetic often develop hypertension. They need to drink a lot. because they have difficulties peeing, so they want to wash the urinary system and so on. And this gives further information. Maybe they use it just to treat diabetes because it's a diuretic. It can be. It can be, because also if you have hypertension without diabetes associated diabetes, also then people often use diuretics. And this kind of information gives you a lot of indications on how to work or in the laboratory, how to select plants when you want to make a treatment outcome study or anything. Okay. So this is really important information, and that's why we always say, no, look at the whole materia medica, not just on single ones, because this is one system that goes together. You cannot slice it up in singular pieces, okay? Next slide, please. So, of course, for documented that knowledge, you need also the hard information, the hard copy of actually the botanical drug. And so it is important that you collect complete specimens to be used as herbarium vouchers, including the ethnotaxa maybe. This can be like the female plant, the male plant, the white and the black leaf of the same species or different kind of species. Sometimes also different kinds of species are regarded as one taxon by indigenous traditional populations. Of course, it's important that before you start field work, before you start the project, now you choose a herbarium, you choose where to intercalate the species with botanical experts that may help you also in the identification of those species. It's not a good procedure if you first collect the plants and then ask. First ask, are you interested? Are you interested in receiving, we're doing a project, you explain the project, are you interested in receiving those species we collect associated with that project, and are you willing to help us in plant identification in case we are not able to identify all species? And then that's also is a good starting point. Yeah? So those species you collect would then be deposited in a herbarium, and they need to be identified, applying accepted scientific terms and names. And what is a very good practice is to work at least 1 year in the field, because probably a little bit more, because staying for more than one vegetation cycle in the field, you get the chance to collect plant vouchers with flowers and fruits. And moreover, you know, the respondents, usually you not work just one time with one informant, but you go after 2 or 3 months, you work with the same person again. Maybe you meet him accidentally on the roads and start talking or whatever. So you get at different points of the time over the range of your field study, you have different interactions, and the way people respond to use of plants depends on seasonality also, because not all plants are apparent over the whole range of the year. And not all diseases are present to the same extent over the whole range of the year. There are also festivities for which some plants or botanical drugs or spices are very important. And, you know, people recall that information much better when it's actually happening. So that's why it's good to stay. I was 1.5 years in the field, on and off, yeah. So that gave me a good picture of what people actually use. And there are also markets. Also, the markets are important to look at. The markets where medicinal plants and food plants are being sold. Also, the composition of those markets changes, of course, over the year. You know, and to grasp that. Those differences. It's important. I mean, it gives you a complete different picture when you go just for 1 week in June, whether you go in 1 week in November, for instance. Okay, next slide, please. Oh, this is how you would. Probably this is An example of a fern that has been laid out for desiccation in a device for preparing herbarium vouchers. Okay, next slide, please. This is my one of my ex-PhD students who is preparing voucher specimens in the field. Next slide, please. Oh, it's working hard here, you can see. Next slide, please. And after the work was done, you can see him very happy. Okay, next slide, please. This is how...
Amit, next slide, please.
Yeah, it's good, we are there. So what is then also important when you write a paper in the method section, you should specify the source of species and family names, okay? There are different databases and they are not all the same, you know? Some are static and outdated, but the most important is that you state which you have were connected to, which you have used for your botanical names, okay? You can also use guides, species lists, or whatever, or taxonomic books also. It's not necessary that there are online databases, but the online databases, especially those of Q, are quite up to date. Okay, next slide, please. So a very sensitive part of such presentation of the results is the systematization of the data. And you have different kind of data. You have qualitative data, which is descriptive data, and quantitative data, which is that kind of data that you can count and measure. The qualitative data is can be like different types of healers present in the field, the explanation that the healers give you regarding the healing properties the plants have, how do they select the remedies, the different disease categories, the cultural disease categories they identify. The emic category is the cultural one, so their own medical system, and the ethic one is your one, is the biomedical perspective, okay? So this is like qualitative data. Next slide, please. And one of the most crucial things in qualitative data are the disease categories. So they are very often, because if you want to make a table, and usually the results are presented in a table, okay, in a table in the paper, you present the table. Then these plants, the botanical drugs, are organized into disease categories to better understand the data. And the emic, as I said, is the cultural perspective, and the biomedical is the ethic perspective. And then the quantitative data is reported like that. For instance, it's used against plant, or the botanical drug is used for gastrointestinal disorders, like 10 times from all 100 informants. And then you say also how many times for the specific uses. Twice against diarrhea, once against dysentery, 5 times against stomach ache, and so on. But the more difficult thing is, and something that needs to be done in the field, together with the informants and collaborators, is to visualize the emic categories of use, just the cultural categories of diseases or health problems. And this you can do by using a combination of free listing and pile sorting. Free listing means that people, you give them like important, they write, you write on the diseases or health problems they mentioned to you when they describe the plants, and you write them on little papers. So you also write the plants on little papers, and then give those piles to the people, and then can, together in a discussion, they sort these little pieces of paper into little piles what goes together and what is different. The next slide, please. Like that, for instance, you can use little papers, or you can draw it on a wall and make some charts where diseases and plants go together. Next slide, please. Like this, you make a huge discussion round, huge or less huge, with the informants that are willing to collaborate and they're interested in the discussion. And so you can then at the end get like some sort of phylogeny of cultural diseases and plant uses as well, because it goes together. Okay, next slide, please. This is not the cultural way of classifying diseases or health problems. There are different internationally accepted from the WHO. There is the ICD, the International Classification of Diseases, for instance, which is used by medical doctors and pharmacists and so on. But this one is really, really dependent on exact diagnosis, which is not possible in the field. If you want to make comparative studies, compare one cultural group with another one, which intrinsically have probably different way of categorizing diseases, then you can use like an international classification, like that of the International Classification of Primary Care, where there is just where the classification has been done according to the reasons of the patients for seeking a doctor, which is not so much dependent on diagnosis. Okay. Next slide, please. Of course, the quantitative data is open to statistical analysis, and the most frequently pursued analysis is, of course, to find out which remedies and which botanical drugs are those most frequently used for the respective health problems by that population, okay? And this is often also seen as a proxy for drug discovery, because you say those that have a higher consensus maybe are also more potent, they are more reliable, they are more effective. Both have been shown. It had been shown that actually is like that, but also the contrary. Also, plants that are not so frequently used can be quite effective, actually. How you count your data in the field is through use reports. A use report is like one individual report of a specific plant species or better botanical drug, because from one plant species you can have different types of drugs with different ingredients, with different properties for a specific ailment and category of disease. Okay, next slide, please. Yes. Next. So when you present your data, what is important, that's the primary data is presented in a genuine and unaltered form, and not through indices. Today, so many indices are being used in ethnobotanical studies, use values, cultural importance, relative importance, and so on. At the end, this is a single number. If I know this, like mango has a use value of 0.8, pharmacologically wise, it doesn't really tell you anything. A single number cannot tell you more than actually what the primary data is showing. The primary data is what is all about. And also this percentage calculation, like relative frequency of citation. This is just a percentage calculation. This has been ever done. And there's no need to explain what the percentage calculation is, what is often done. They come and start, we use the relative frequency of citation, then they draw a complicated formula, while it's only just taking the percentage of how many people responded with a specific plant for medical use. I mean, It's quite basic, isn't it? So it's really about using raw data. And if you use statistics, then use statistic that has been developed in statistics and with a specific hypothesis. Why is this statistics now important? What are you wanting to show? Why is this the method of choice? Why is this the right methods, and what is possible to show with the application of that statistical method, and why it's important? What is, of course, very important also is that the medicinal flora, the whole materia medica that you gathered, is assessed critically, considering the regional, the global, and scientific information. But first of all, of course, the regional data, in order to use it for comparison, to find out what is actually novel here. What are those people now use differently, make different than their neighbors? Or is it the same, and yes, same, why? Because they use the most effective ones, like the neighbors, they are the same. The least effective ones are different. And of course, there are some global medicinal plants now. Ingwer is used by the whole world. I mean, curcuma as well. So therefore, also these, sometimes I get papers that say like ethnomedicinal plant. But what is an ethnomedicinal plant versus a medicinal plant? I see no difference. So why was it there say better to say medicinal plant and not ethnomedicinal plant? Because it's a medicinal plant. Don't make it more complicated than it already is. And what also often when people are submitting papers, just focusing on one specific indication, they say the anti-diabetic plants. You know? And I write back, these are not anti-diabetic plants. These are plants used to treat diabetes. But whether or not they're anti-diabetic, this is the research question. This is actually the justification for ethnopharmacology. The pharmacologists then look, are those plants used for diabetes also really active in reducing the symptoms or curing diabetes? Okay, next slide, please. Yes, of course, you need to have the permits and ethics in place. You need, the basic thing to do is maybe to, first of all, go and contact the national focus points that grant permission to extract biological material, and you need to go to the field to work, to talk to the local politicians, to the people as a whole. Make a little first talk to the major, to the chief of the village, and transparently explain what are you going to do. That you are planning to do a field research in their community, if this is okay, whether he can or she can hear the colleagues, what do they say? Do they agree? Can we come and present to the whole village the project and explain the rationale for why we are doing it? If you do this at the beginning, upfront, and not just one day show up and start doing things and question out people. If you do it like this, then people are much more confident. People will be much more willing to collaborate and share important information with you. Especially if you also maybe, and this is important to plan too, tell them that you will write actually a book in their language, whatever the language is, a language that most of the people can access, where all that knowledge that they tell you is being written down, and they will have it as an electronic or hard copy form for their library, for the little library they have in the village or whatever. There's something they can be proud of. There's something they can show to future generations. Okay. Okay, next slide, please. yes, of course, you need to be in line with the ethics, with the conservation of biodiversity, with the sustainable use of biodiversity, and the fair and equitable sharing of benefits arising from the use of biodiversity and genetic resources. Yeah, maybe the people there, the local people, they think you want to come and steal medicine and then get rich with that, and they receive nothing then. So you need to have such a paragraph in place to say that if anything should arise, and if the knowledge you use for commercialization is really only there, specific of, which is quite difficult because nowadays, you know, most of the plants and botanical drugs are used across India and Southeast Asia and even the whole world. So, but if there is something that really only they use, even fermentation, traditional fermentation procedures for cracking up biocomponents, for instance, so that this must be written down that they will not be overlooked financially wise. Next slide, please. So the Nagoya protocol requires the prior informed consent. This is the one I was talking to before. You go to the village, ask the village people, do we want to collaborate with you? If yes, this will be written down and on mutually agreed terms, you know, also established with the national and the local authorities. And in case you want to, in this case, it's not really important because you don't want to export anything, but otherwise, this is a very crucial and very difficult procedure as well. Okay, next slide, please. This is the outreach my PhD students did in Mexico, in Chiapas. So he involved even the scholars. He went to the classes, talked to the teacher whether he can give some extra classes, and explained to the youngsters what he's doing, why this is important, what they can learn from it, and so on. And he gave them an introduction in the project and let them have also plants pressed and so on. Next. Slide, please. Here you see my ex-student in the classroom talking to the people about traditional medicine in general. They're quite interested, actually. If you tell them, if they realize that you know something, that you have something to say, they will be interested. When you talk about Europe, that people also use this plant in Europe, they're interested. Next slide. He gave also interviews via the radio in order to involve as broad population of the Soke people as possible. This was really important so that all the people were willing to collaborate with him. And that's why the PhD thesis was quite a success. Next slide, please. And at the end, he really wrote a 300 pages book in Spanish, including all the information people gave him. With all the plants, pictures of the plants, scientific data as well, because they were interested. Is there any data in scientific documents sustaining the use of what we are doing? People are interested about that. And I think they were quite happy. Next slide, please. And all this information that I've, or more or less, all the information that I've now given in my talk is also written down in that setting standard paper about the recommended standards for conducting and reporting ethnopharmacological field studies published in the Journal of Ethnoparmacology. It is open access. Thank you very much, and if you have questions, I'm happy to discuss.
Well, thank you, Professor. Now, may I request Dr. Pradeep to kindly ask the questions to the audience, please?
Thank you, Professor Marco, for highlighting how people are using these natural resources for healthcare practices and how to document all these practices. So, as we know, whole of the world is looking for documenting the wealth of traditional knowledge that has been developed by indigenous people and local communities. So the major question comes around is intellectual property. Although you have defined about the Nagoya Protocol and what are the criteria we have to follow. So can you elaborate something on what should we consider for putting the IPR using this documentation?
Well, you need to probably you have a statal biodiversity, a governmental agency in Mizoram. You need to find out what their duties are and what the exact protocol would be. It can be that they are not yet in place. There might be they even don't know. I mean, it happened to us here in Europe when the Convention of Biological Diversity was just applied. In Italy, we wanted to we collected the plants here, you know. People said, yeah, well, you can. We have nothing against it. Yeah, just don't take the rare ones. Yeah. And the knowledge, we did not here collect the knowledge here because the knowledge we extracted from books. But about the knowledge really is just with the people there. The knowledge is just the people, the local people you get the knowledge from. And the other one is the biological resource. Yeah, there's two different things. So, and about the knowledge, there you can also see whether there is an Indian legal framework where you can base your bilateral, your consent form.
Yes.
Yes.
Thank you.
Like this, yeah.
And second question is regarding this, you mentioned about quantitative and qualitative data and their statistical analysis.
Yes.
So should we go for the number of traditional healer for particular conducted for particular disease or particular plants, or it can be other ways also?
Well, I would really keep everything open. Just go to the healers, whether they are just healers for one specific disease, like snake bite healers. In Mexico, I had those healing only snake bites. But I went also to midwives, bone setters, all of them. And I just, all the information they gave to me, I was never looking on one specific disease. But when you write a paper afterwards, you can always do that, of course. But keeping in mind the whole profile of users specific botanical drugs have, which just gives you information. If you want to focus in a paper only on malaria, for instance, or only on diarrhea, you can do that, of course. But when you collect the data, I would just collect as much data as possible to keep everything open. And then when you look at the data, you have to study the data that you gather. Then you got a huge set of data. And then you start comparing the data also with those of neighboring people. And then the interesting question will come to your mind. And then you can focus.
Yes.
Yeah.
So one more question is there. Common botanicals, those can be identified very easily, like ginger, turmeric, etc. Is authentication required for those botanical also?
I have to admit that also the most common ones, I did not make voucher specimens. You know, ginger. Yeah, everyone, it's just it's one species. It's always the same. It's ginger. So I did not make, myself, I did not make a herbarium voucher for ginger, for instance, because it was clear that this ginger is ginger. Also, to have maybe several species, I don't know. If there is a difference, if there are several species, they have differences of application, maybe. But if the most common ones, like black pepper, no, there's no need. I think there is no need of making herbarium vouchers. You do, of course, the more difficult plant identification is, the more important is that you make.
Okay. Okay.
And those that we already
Thank-
really sold in the
Ci sto
shop.
lavorando.
So
Okay.
this is, yeah.
Thank you, Professor Marco. Now, because we are in the end of this session, because Professor Pulak is busy somewhere in another meeting.
Okay.
So he messages that we can conclude here.
Okay.
So with this, we would like to thank you for your time and your this presentation altogether. Thank you very much.
Thank you too. And whenever you have questions for whatever kind, we just keep in contact. You write me a mail.
Sure, definitely.
Oh, happy to come over as soon
Yes.
as possible to Mitsubishi.
Yeah. Thank you.
Yeah, thank you.
Thank you.
Bye-bye.